And now it's my pleasure to introduce our speaker. Happily, Dr. Kaylynn Bowman is a Roadrunner. She earned her Doctor of Pharmacy degree from Roseman's Henderson campus in 2007. She also earned a Master's of Science in Pharmacy, Medication Therapy Management from the University of Florida. She's a clinical adjunct faculty member for Roseman's College of Pharmacy and provides medication therapy management services for the Roseman Medicare Call Center. She also serves as a consultant pharmacist for St. Rose Dominican Dignity Health Wellness Programs. Dr. Bowman is truly an expert in this field, and I know we're all eager to hear her presentation. And so, welcome, Dr. Bowman.
Well, thank you so much, Brenda. I'm really excited to be here. This has been a part of my grant process is to provide a training to the community on diabetes, self-management, and education support. And I'm very excited to have the support of Roseman and also that of Dignity Health. And of course, the Roadrunner series. Just a disclosure that this program is supported by a grant funding from the CDC 1815 grant. And I'm also a consultant for the RX Healthy Living, which is the owner and founder, which is how I consult with Dignity Health. Tonight, I would like to go over the goals for providing innovative DSMES support during COVID-19 or during the pandemic, and especially looking at the starting point for pharmacists. I am one, and so I really advocate for pharmacists being part of the team care process, how to integrate DSMES into patient care, what current medication management and DSMES projects I'm working on, and of course, expanding services out into the community. So just to give you an update on what the CDC, it's called CDC DP 1815, it's state, local, and national partner diabetes program. So if you were to look up the CDC 1815 grant, it would explain about the looking for diabetes and heart health. And these fundings are given to the state, which is how I'm doing these programs. So it's to develop pharmacist patient care process to assist with diabetes, people living with diabetes managing their medications. They want to increase demand for DSMES services by improving access and participation in programs. Of course, improving the health benefit coverage for diabetes prevention programs, often called DPP, and to collaborate with community and clinical linkages for referrals to support and retain participants enrolled in these programs. So these are some of the cornerstones of the funding. And what I do is I look at increasing the pharmacist work in what's medication therapy management, often referred to as MTM. And this looks at patient care processes, DSMES services, community referrals, key partners in Nevada, which is really important that we get out in the community to let others know what pharmacists do, how we're part of the team care process. And additionally is to reach out to rural areas in Nevada to provide support for all community members. So in developing MTM standards, it's really important to understand what it is that I pretty much offer patients when they have medication reviews and are referred to the programs that I'm involved in. And these started with, in 2008, the APHA came up with the MTM core elements of service model. And these elements contain 5 components, which is the essence of a medication review. And that includes not just prescription medications, but supplements, herbals, vitamins, dietary products, pretty much anything the patient might be using. That creates their personal medication record. And as part of the interview and review process and understanding how they take it or why they're taking certain medications, I create a medication action plan. And in no way is this changing the medications or stopping. It may be taking their thyroid separate from other medications. It may be an educational component to understanding that why they're taking other medications or how to use their diabetes supplies. Also, it can include recommendations for immunizations. So a medication-related action plan are things that the patient takes away and works on after the call. If there is a need for intervention and follow-up, the report is then also sent to a provider to indicate that there may be drug interactions or therapy needs to be modified, and then the provider takes the course of action that they choose. It's really important to include documentation. Pharmacists aren't always trained on documentation. That has been changing with the use of these tools, and always follow up. Once the initial medication review is offered, there always should be a chance for follow-up, whether it be a few weeks later or within 1 to 2 months, to finish up the process of how they went through the action plan, if there's any changes to the medication due to contacting the doctor, or if they had life-changing visits to the doctor or illnesses or new medications. So some examples of interventions can be taking unnecessary medication. Medications like herbals and vitamins sometimes are duplicated or extra ingredients that they may not realize are in more than one medication or a supplement. A medication has not been prescribed. Often there's missing therapy or standards of therapy that should be recommended. Medication is ineffective. It's at a low dose or ineffective dose, or causing side effects or reactions. And a lot is patients not taking the medication correctly. I've had instances where in reviewing medications for the first time, they actually read the label on the bottle and realize that they were not taking it correctly. It's quite interesting that every interaction with the patient is unique and individual. And there's no way to say what one person will learn from one review to the next, because everybody's unique. So this comes a question to me a lot when referring to services or working with patients and or family members, and why should they be offered a medication review by a pharmacist? And so they're like, well, why would I need this? How will this service help me? My doctor checks my medications. I keep a list at home. Nothing's really changed on my therapies. And I usually say that all types of people need help with their medications, and specifically those with chronic health diseases. If they're on multiple medications, some people are on 5 to 10 medications, and every time you increase over 5 medications, the chances for a drug interaction also can increase. They might have high out-of-pocket expenses, and offering an alternative may be helpful. Some have complicated medication routines. They have to take it on an empty stomach. They can't take ones with others. They have to space them by 2 to 4 hours. And that can make a daily routine very difficult. A lot of people don't understand why or how they should take a medication. They don't know how to use inhalers correctly. They don't know why or what the medication was used for. They've been taking it for so long, they forgot. So they're unsure of that. And I'll get a lot of questions about herbal products interfering with their prescription medication. There are some really great programs out there that I used to do a drug review, including Lexicomp or clinical pharmacology, to help with some of the drug interaction reports that I work with patients on. So these are reasons why I offer the service and to explain why it might be necessary. So in working in retail and working with my students, and even offering some trainings to students at Roseman University, I talk about a lot that the incorporation of medication therapy management may be something they're already doing and not realize that's what it's called. And so in the pharmacy, in most retail pharmacies, in hospital pharmacies, in independent pharmacies, you might be doing adherence calls, calling for refills, seeing how the drug's working. Are they need new drug therapy? Did we do patient education on the new therapy? Did we change a 30-day to a 90-day? Offering medication synchronization. I know a lot of systems are offering that now to improve how often a patient goes to the pharmacy to pick their medications up. Checking out drug interactions or doing calling doctor on drug interactions. Reducing high-risk medications, offering vaccine recommendations, which of course for the last couple of years, it's been a real huge burden at the pharmacy, taking care of during the pandemic, COVID-19 vaccines and the normal age and disease state appropriate recommendations for vaccines. And then the comprehensive medication review, which is also offered as part of these services. So in essence, all these different items are considered medication therapy management services that just not understood as that's what it's called. So as part of offering these services, understanding that we need to have some consistency in how we work with patients and how we chart and document the information. The pharmacist patient care process is really the essence of how we should collect the data, assess the patient information, create an action plan or a plan of how they're going to take the medications or address their health needs, then offering how to implement. And this should be done in conjunction with the patient's understanding. This is not me telling a patient what they should do. This is us having a conversation about their health goals. What do they want to work on? We can't do everything the first visit from medication review. So I prioritize what's important for them to change, including what some of the things that I can make a recommendation on. Once that implementation process occurs, then it's the follow-up monitoring and evaluation. Most of the time, I'm getting their medication list for the first time, talking to them. I may not have access to labs unless I'm in a situation where I have access to an electronic health record or they bring the labs with them to the appointment. So checking to see if the medication's been optimized is limited. The patients may not even have gone labs recently. They may not have gone to the provider or seen a provider in a while and may not have that information available. So that's something you can add to the action plan. But the most important thing is that the patient care process includes the patient and their input is really important. This is really a together, you work together to find how to make those steps and implement that as a care plan that they can then execute. Part of that is knowing where to go for resources. So one of the resources I use and teach on for training is the diabetes standard of care. It's updated every year, usually comes out in December. In January, it's typically published and ready to review. So each year they do a short one-page update. If you haven't spent time reviewing it or reading it, there's some really great chapters and there's a section for everybody. I really enjoyed the first chapter, which is the understanding and taking care of patients based on social needs, which includes access to foods, access to risk for homelessness. Another one is, are they a migrant worker? Things that may affect the uniqueness of their care, and the tailoring the care to that is very important. Social determinants of health are really important at that point. So checking out the standards of care every year and seeing what the updates are is really important. Last year I did this Roadrunner series. I did an emphasis on more on the standards of care. And this year I'm focusing more on the accessing for patients resources for diabetes self-management, just to let you know the difference from last year to this year. It's really important when collecting data and working with patients that we have recently, as pharmacists in the pharmacy, emphasized the 3 public health service questions. And this is something I've worked with my students on, and it helps me guide the conversation with the patient, especially when counseling, which is, what did the doctor tell you this medication is for? There's a lot of different indications for medication use. And instead of me guessing, I ask. It helps out a lot. How did the doctor tell you to take it? That's important because sometimes I might get a prescription that came in with certain directions and the patient may have been directed a little differently. So that also helps me get an idea of what we're using it for and what the patient was told. And what did the doctor tell you to expect? Is this something they're doing short-term, long-term? Did they tell them about side effects? And this also helps me minimize and reduce the time I spend at the counter, just, you know, kind of giving my spiel or my speech of what the medication should be used for. I can tailor it now to fill in the gaps or fill in areas or questions that the patient may have. If I have time, I can do more of a focused interview, which is what are the health conditions that you see the provider for, what are all the medications you take, and what happens when you take them. That's really important to get a history of past experiences patients might have or reactions. With data collection and interviewing patients, and even I found that there are some barriers, is empty spaces. Sometimes I get ahead of myself, or I didn't have a chance to ask a question. And so I have empty spots on my recording or in the chart. Sometimes I have lack of space, like when they're filling out the forms, there may not be enough space for them to fill in everything they wanted to say, or it's out of order. And they may not remember if you ask them about when was the last time you had a pneumonia shot. They may not recall if they even had one or which one they had. They may not remember what their reaction to medication was or what their side effect was. And so there's the recollection or recall for data information. Usually at the end of most of my medication reviews, they get a personal medication record, which is a list of everything we talked about. And then again, an action plan, which talks about things that they want to work on and things I can follow up with them later at a later date. And it kind of gives them an idea of what the priority of what they want to work on and why. When it comes to integrating diabetes self-management education support into patient care, it has really, I've seen a big difference this last year and a half during the pandemic, the need of patients for additional assistance, not only on calls for medication therapy management calls, for comprehensive medication reviews, but even in the pharmacy itself, being able to help them out and guide them with simple things like working on their diabetes equipment that's not working, not understanding their medication, they can't get a hold of their doctor, questions just about general health. So there's this really great article on the effective model of diabetes care and education. The ADCES has 7 self-care behaviors. And they identified that the healthy coping is a key to being successful in modifying or managing the other behaviors. So without being able to do the healthy coping, it's going to fall short on being able to monitor for their blood sugars or being able to manage their medication profiles. They may have difficulty in problem solving in a stressful situation. Their eating and activity may be different due to the stress. And this is what I saw more of during the pandemic and COVID-19 isolation, or those who couldn't reach their doctors, who were staying home and weren't coming out of the house, is the healthy coping. And that was really an area that can pharmacists and other healthcare providers can help with patients, is the coping skills. Those who are at higher risk in the article stated that it would be those who are unmarried, those who at low socioeconomic, and unemployed would be at the greatest risk for not having those coping skills. So how can pharmacists, what are the roles in promoting these self-care behaviors? It was identified in an article that providing patient support and interventions to lower stress and depression. So that's number one thing we can do, making those calls to the patient about their medications. Hey, you might be falling behind. Have you come pick up your medications recently? I haven't heard from you or seen you. Those are really ways that we can connect with, is providing a support structure. Encouraging movement and activity for regular exercise. A lot of gyms shut down. People weren't going out. There's a lot of issues with reported for weight gain, which affected A1Cs. It affected the ability to cope with managing their diabetes stress levels, is the fact that a lot of routines were disrupted. And so when talking to patients about their activity or diet choices, it always comes back to things were disrupted during COVID and isolation and shutdown. And so now that for some, it's eased up a little bit, but with reoccurring infections and reinfections for COVID, I do still have clients who are wearing masks, who are not going out and about, who aren't going to the gym, they aren't exercising as much as they would like to, and they're still having issues addressing these weight gain and exercise activity resources. Personalized attention to address barriers for medication management. They can't get a hold of their doctor, or in one case today, I was talking to a patient on their medication review. The doctor's primary care office shut down for 3 weeks due to a COVID outbreak within the office. So her next visit won't be until July, like mid-July. And so this is a very real and still active case issue where they may not be able to call the doctor and talk to them about low blood sugar issues or starting new medication, and they can't follow up. So personalized attention is really important for clients that are patients who are coming to the pharmacy. Assisting with glucose monitoring and equipment training. I don't know about you, but I've done a lot of training on troubleshooting monitors, diabetes, the Freestyle Libre, which is the continuous glucose monitoring systems. They're falling off, they don't know what to do or how to install them, how to read them. So that's one area I help with. Another is their pen needles aren't working. They're coming to the pharmacy saying their pens are broken, their flex pens. And what it is the needle they put on has been damaged internally and it's not poking through the rubber seal, and they're not able to inject their insulin. So assisting patients hands-on at the pharmacy, you're so accessible that it's just an area to help with equipment and training. Supporting healthy eating behaviors and healthy food choices. We can give some basic help on, they may not understand that you can see the baskets or recommendations for how can they make some changes in their life. What's 1 or 2 things they can pick or choose to make a difference? They're eating at home, they're cooking at home. How can you help guide them? And what are some resources that you can help them with? So these are all areas that I myself have helped out in, but there's definitely a role for pharmacists to step up and take action within the pharmacy, especially when patients aren't able to get to other providers as easily. Another way that's been really innovative and is using multiple different ways to access patients besides being in person. And so telephonic, which is telephone, that's a very common one for me to use. Telehealth, and telehealth can incorporate telemedicine, but telemedicine is not what I'm talking about. Telemedicine is directly for like providers providing medical care. So telehealth is like a broader category and includes all types of technology and interventions. Texting is a new one that I'm looking into, is how to get texting out to patients in a HIPAA compliant manner. A lot of pharmacies use different texting modes to let people know their medications are ready. But what about engaging them on testing their diabetes, blood sugar, or how are they taking their medication, or sending messages or prompts to them for diabetes education? So this is a new area that you can also use. And now that some people are going in person and staying virtual, I see some hybrid classes and workshops and events that are still being offered both manners. There's this amazing guide for telehealth technologies in DSMES. And I'm hoping you guys can see this okay. But it's a guide that if you want to incorporate different telehealth possibilities in your pharmacy, this review goes over each method, whether it be texting, smartphones, websites, video, virtual, and the benefits for each of those categories and how to maybe go about implementing that. It talks about how to get started. And what I really like, it talks about how to get reimbursed. So if you're an actual certified accredited location for diabetes education, you can provide virtual or telehealth type of training and education opportunities and possibly get reimbursed by Medicare. So this is a really great resource. I think highly recommend it if you're in have the ability or a facility that offers these resources, to make sure that you're maximizing your opportunity to reach out to a variety of types of patients. And why is that important? Because everybody may not have access to technology, and they may not be comfortable with technology. They might have limited resources, bandwidth, or connectivity. Not everybody has a smartphone to log into Zoom or log into different opportunities that allow for technology-driven virtual formats. And also, there's some that just aren't technology friendly. They may not have the aptitude or the patience to access these technology advances. And so ways to overcome those is utilizing your staff, whether it be a community health worker or pharmacy technicians, staff in your office, and creating tips or fact sheets for accessing your resources, empowering your patient on how to connect and utilize the technologies, and just simply helping them connect to those technologies may ease some of the discomfort they might have in utilizing technology as part of the telehealth process or virtual process. Virtual visits, I think these have been great. I myself have used them for my own health, seeing the doctors without having to drive to the clinic. Sometimes it's really great to have that flexibility and incorporate virtual visits into the healthcare model. I've done virtual visits for, like this one here, doing Zoom meets or team meets, allowed for classes, training, and meetings. It's a great opportunity to get more people involved. I've used Doximity and DoxyMe, which are HIPAA compliant telehealth programs. Allows me to virtually see the client on the other end of their phone. And, you know, in some cases, they didn't understand their medication. They were able to show the bottle to their camera, and I could see what they were reading without having to be in person. There are some costs involved depending on how much of the versatility of the program you want to utilize. But I still use Doximity, which has been one of my original, and I did try both just to test them out. But having a virtual waiting room, have them connect and log in, and to again see each other virtually and be able to do that in a HIPAA compliant manner was very helpful. Integration into the healthcare records. So at one location I was at, the virtual visits were part of the electronic health records. And so that in itself is really accessible. And then you have the labs, you have their charting, and you have the virtual option all in one. So there's different models out there of how to use virtual visits. And why is this so important? Because it's really important that we all get to know who our community members and partners are. Because if we can't help patients, we need to be able to refer them to facilities and organizations that have some of these programs in place. So first of all, I've been working with Dignity Health with these grants for 4 years. This is my 5th year starting on providing medication therapy management opportunities for patients in their programs, including diabetes prevention, diabetes education, heart healthy. We do congestive heart failure has been a new one. And so they can be referred to me, and then I can also refer them to the Dignity Health programs. I've been in Las Vegas and been a pharmacist in pharmacy for 17 years. And it wasn't really until the last 4 or 5 that I realized that there are many opportunities out in our community for providing patients with additional resources. A lot of times they're free and at no cost to them. And in these cases, some of these are even virtual classes for those who aren't going out in person. A new grant we received was Flip the Script, which is a Ryan White grant. And again, I provide medication adherence, medication management, and health education, risk reduction, health classes, and support group classes. And this again is another great way for me to learn about opportunities for clients who are living with HIV, and hopefully to help those with PEP and PrEP. So great opportunities, amazing options for pharmacists out in our community. I have been working with Roseman for the last year or two on the Medicare call center, where we do MTM opportunity visits for patients who have Medicare, also with the senior center here in Nevada, helping them understand why their medications are expensive and how can we offer alternative options or better choices for their Medicare opportunities. I've collaborated with Roseman Medical Group in providing team-based care, providing education and integrating into their healthcare, electronic healthcare records. It was a great opportunity and to continue growing and finding new opportunities out there to engage with our community partners. One of the things that is really great in the opportunity, not only at the pharmacy, but working with our community, is creating increased opportunities to find patients who may be at risk for diabetes. This is the American Diabetes Association. Are you at risk for type 2 diabetes? And pretty much typically after the age of 45, you usually start screening. But if there are other factors at play, you can screen earlier. And this is a way to identify patients who may not realize that they may be at risk. And so having a way to incorporate this into your workplace, wherever you're practicing, is a great chance to find out who's at risk and how to refer them to a diabetes prevention program. They have found that through the studies I read that the at-risk population may not be getting access to screening as much as those who may already be diagnosed or who may not be at risk. So finding the population might be at greater risk and screening them is another untapped resource for pharmacists to participate in, and then refer them to appropriate accredited diabetes prevention programs in our community. So usually you can go online and find a nearby program. So the CDC has, oh, that's the diabetes class. So this is the Dignity Health has a diabetes lifestyle training nutrition services at the different locations. They are across town. There's 5 different locations along with the major hospitals. And they do the diabetes prevention program. And that is, you can sign up for it. And you can see that they are a variety of opportunities at different locations. And most of these programs, if they're in person, they charge at a cost of $10. If it's virtual, it's free. And so there's many opportunities out there. So when patients say, well, I don't have that as part of my insurance. My insurance doesn't cover a dietitian. My insurance doesn't cover diabetes education. This was a really great opportunity for me to find out that I have a place where I can refer patients for educational opportunities that are low cost or free. So I encourage you to find out. And this is basically the Dignity Health. I usually go to classes and events, and you can see there's a variety of classes and events, including education for diabetes, disease state management, fitness. Fitness is a great one. I don't know if you know this, but even you can sign up for it. But they have bingo size. I saw that the other day when I was at the Green Valley location. They play bingo and exercise at the same time. It looked like a blast. They also have Zumba and Tai Chi, yoga. And so for those who, and these are offered virtually too. So those who are having at-risk exercise opportunities where they're not having fitness or don't want to go to a gym, there's a variety of opportunities here to have your patients maybe sign up for a class. Again, it may seem like I'm focusing in on Dignity Health, that's just because I know it very well, but please let me know if you have locations, opportunities, places here in Southern or Northern Nevada. I would love to include it. I'm in the process of finishing up a diabetes self-management education support toolkit for pharmacists. We're in our final edits, and it should be out soon. And I would love to include anybody, if I haven't already, to include your information into this toolkit. Let me go ahead and close that. So it's really important to know what's in your community and how to refer patients out to those services, and also to identify who might be at risk to help those who may not realize that they have an undiagnosed disease state or potential for one. A really new one that the Dignity Health program rolled out was hypertension and heart health management, where they help patients measure their blood pressure, monitor it, and they can also sign up for a fruits and vegetable program for nutrition. So those who might be at risk for lack of access to fresh fruits and vegetables, they collaborate with a local farmer here in Southern Nevada, and they deliver the food directly to the doorsteps. And so if you have clients who are at risk for nutritional issues, there's amazing programs that they can contact and either work with a dietitian or have food delivered to their home, including those who would potentially at risk due to social determinants of health. When working with patients, I usually have a notebook, a 3-ring binder that I keep with me that has handouts on blood pressure, like a tracker, salt tracker, track the amount of salt that you eat in a day. I have handouts on how your diabetes medication works or your blood pressure medication works. So finding ways to help educate your patients is really important. I use American Heart Association. Life Simple 7 is a very popular one for me. If you haven't gone there before, it is has handouts for all types of topics, including infographics for monitoring sugar, how to eat better, quit smoking. And the one I use a lot is even cholesterol. Cholesterol management is a big one for patients living with diabetes because they don't understand a lot of times why they're taking cholesterol medication or why they should be on it for long term. Another one I like is Cardio Smart. Cardio Smart is for the American College of Cardiology, and they provide infographics in a variety of topics and languages, which is really important for those who might have language barriers. And so this is another great way you can find a variety of methods besides infographics, content, video, and action plans are available at CardioSmart. It's a great resource. For Dignity Health, they have a newsletter and they print it out every quarter. So you can see these are the different locations around town that are given a code. And when going through, I'm at the bottom of the newsletter, but this is the spring 2022 newsletter, the one that they currently have out. And you can see that they have a variety of classes available for, here's a current diabetes management. So even if you weren't sure, accessing their quarterly newsletter or for the different, like there should be one coming out for July, August and September should be coming out soon. And I'll have the current classes, costs and locations, times and accessibility to those programs. I bet you guys may not know all this. This is a really great time to learn about what's out in your community and how to refer patients to services once you identify need that they might have. Besides the Dignity Health, there's the CDC DSMES toolkit. The CDC has a toolkit that's just out there for providing DSMES courses, classes, how to get accredited, how to start it, how to advertise and retain clients in your program. And it looks like this. So it gives you all the different categories you may think about, including marketing, promoting your DSMES class. If you're interested in that, you know, there's really great funding out there and opportunities to connect and to engage in promoting it and getting referrals to your program if you want to start a diabetes like prevention program at your location. You can also become Medicare accredited for those diabetes services, and those are reimbursable to when clients come in and are seen and come to classes, you can submit billing for those. There's a diabetes education program locator. That was what I was looking for earlier, where in this case, if you put in your zip code, let's just say I put in 89014, which is Henderson, it gives you, let me see here. It tells you what's here in the Las Vegas area. And so these are the ones that, see here's Dignity Health. There's also Transitional Healthcare of America. And there's one up here, Health Promotion Operations. And these are actual finding a program for the National Diabetes Prevention Program. So you can actually find an accredited program to refer your patients to, if you can't remember. There's a gethealthyclarkcounty.org. I like this one because it gives me a list of trails and places in town where parks and recreations are. It has a lot of opportunities, like if you want to walk around Nevada, it gives you ideas of where to sign up and how to participate in walking and success stories. So that's a really great website. And Nevada Wellness DSMAS programs, this talks about just how to get established. Here's the 1815 grant. So this talks about the guide for why I'm doing this talk today, which is emphasizing and encouraging providers and those who are providing care to how to identify your patients at need, what you're doing to help them, and then how to get them incorporated into those services so that they can manage their diabetes more effectively to create those outcomes that you're looking for. Of course, one of the great opportunities I had with this grant series was to finally, at the beginning of 2019, before COVID started and we had the shutdown of a lot of our facilities and even Roseman, was to provide a diabetes certificate training through the American Pharmacists Association. And I was very glad to say I finally successfully provided that certificate training just a couple weekends ago. And we were able to train 13 pharmacists in diabetes certificate training, which was a 23 credit course. So for those of you who are looking for educational CEs, that was a great opportunity. I'm hoping to be able to offer that again this next grant year. So if you get an email out there, we're offering those to sign up for free training, which normally is, I believe, a $250 class for the 23 credits. So that was a great opportunity. There's also great resources to know for if they can't afford diabetes supplies, diabetes medication. And I have all these will be on the handouts. So when you get it, you can always check them out. But even when something as simple as the Cornerstones for Care, the Novo Nordisk tools and resources, it's another resource that you may not have been aware of that helps patients to have access to food, booklets, information, and information on the medications that they might be on. It's a great resource and tool. LillyDiabetes.com has another one, which provides education about medications that Lilly does and provides, especially on flex pens and insulin. That's a really great resource. Dispensary of Hope are Volunteers of Medicine in Southern Nevada. So this one's a great one for those who are needing some extra help. You can see that some of our instructors at Roseman even work through or go through the Volunteers of Medicine. So there's a lot of opportunities out there to figure out what's in your community and how to provide resources to your patients. Before I finish up or wrap up for the night, I wanted to let you know about expanding services for pharmacists in Nevada and the scope of work that we are expanding on based on the recent legislation that was passed in 2021. Just to let you know how pharmacists can make a difference in Nevada is that we were able to pass all 3 Senate bills and that they're currently being incorporated into our NRS and NAC code for the Nevada Board of Pharmacy. And so you may see more of this coming out in emails and regulations, including prescribing birth control, PEP and PrEP in the pharmacy, and also improving the collaborations for collaborative practice agreements. If you haven't already joined a state association, there's Nevada Pharmacy Alliance, which I'm a member of, and the president-elect. So this is a project near and dear to my heart. And there's also the Nevada Society of Health System Pharmacists, who we like to collaborate with and engage with. In fact, we have a combined yearly meeting coming up. It's going to be in Reno this year. Last year it was here in Vegas. It will be in person. So we would love to see those of you who'd like to come join us up in Reno on September 24th. And of course, I am the committee chair for the Nevada Pharmacy Alliance Legislative and Advocacy Committee. Our next meeting is August 8th. We do it every other month, where we work on issues that are affecting MTM, clinical services, taking and addressing barriers to you providing care in pharmacy. And all community members are welcome. You do not have to be a pharmacist, and you do not have to be a member of the Alliance, although we would love to see you there, to be a part of our committee. And mainly is to discuss, these were the discussion questions last year, which is what type of services are provided at your work site? Is there reimbursement, payment models for your services? What barriers may exist to providing those services? How receptive are providers, other healthcare providers, in incorporating and providing team care models for you at those locations? Have you been able to implement, or do you want to or consider implementing a collaborative practice agreement under the new legislative that regulations that were approved? And there's, are you interested in how pharmacists in other states are using CDC 1815 funding? The National Boards of Pharmacy, State Boards of Pharmacy has a collaborative call that some of us here in Nevada are on, looking at ways to improve 1815 grant funding and how what they're looking for, and including MTM services and DSMES services. And so at this time, I'd love to open up the questions. Brenda, if you have any Q&A from the audience.
Great. Thank you so much, Dr. Bowman. That was a fantastic presentation. If there are any questions now, please do go ahead as a reminder and put it in the Q&A chat there at the bottom right of your screen. While we're waiting to see if we have any questions coming in, I will remind everybody that if you would like a copy of these slides and you did not register in advance for this presentation, please just email a request to us at alumni@roseman.edu. We'll make sure that you get a copy of Dr. Bowman's slides. And again, remember that the recording of this will be up on Roseman's YouTube channel in the coming few weeks. All right, are there any questions? I haven't seen any come through just yet. I'll wait just another second or two.
While we're waiting to see if there's any questions through, I'd just like to say that I'm really interested in looking at ways pharmacists work with different work environments. So incorporating into doctors' offices, incorporating into independent pharmacies, working in medical practice groups, federally qualified health centers, is to see how, what's in place for medical charting and do they get office time, charting time. There's a lot going on that pharmacists could do that may not be recognized or identified. And so those are considered some of the barriers that, as a work group over the last few years, we were, some of us pharmacists got together at these locations to talk about some of those barriers, which we've now incorporated into the Nevada Pharmacy Alliance advocacy and legislative committee, is to see how can we address some of those barriers that may be up to preventing successful integration into team care models.
That's fantastic, and that's actually quite appropriate, because I do believe we do have some nursing graduates and nursing students and incoming nursing students who are participating. So if you have any specific information that you want to share with someone who is a nurse about questions to ask a patient or anything else, feel free to go ahead.
That's a really great. So when I worked at the collaborated with the Roseman Medical Group, I work with providers, nurse practitioners, and also physician assistants and their students, and working on identifying like what does a pharmacist do besides provide drug information. And so when I first talked about doing a medication review, a lot of other providers may not be aware of the skills that pharmacists have and training. And so that's one of the first things that I do is I go through, what is my role? How do I integrate into the patient care model? And it's not that I'm doing what you're doing, is that I'm adding to the patient education. I'm adding to their knowledge. I'm a way to help out with chronic. I usually take care of the more complicated patient cases, and that frees up time for the providers to see more patients And I can work with that one patient that might take 30, 45 minutes. So the more complex patients are definitely patients that I work with more often in a clinic setting.
Wonderful. All right, looks like we do have a question. Okay, a nursing student is asking about how this can be translated to nursing students, and are there any similar certifications for diabetes management that you know of?
Often the CDES is a certified diabetes educator. Most nurses and dietitians are CDES certified. The ADA also has a certification program. And in fact, at Dignity Health, the dietitians and nurses actually manage the diabetes accredited programs, the diabetes prevention program and the diabetes education. It's called DEEP, the DEAP. And so they are the ones who are CDE. It used to be called CDE and they changed it to CDES certified because they have to have, it used to be more hours. Right now, I think it's 1,500 hours within a 3-year period of working with clients who are living with diabetes. And that's kind of hard for pharmacists to do because one, we're not in a clinic setting. I'm not in the pharmacy. I can actually quantify the number of hours I spend with specific patients for diabetes, but nurses and dietitians are more likely to do that. And so reaching out for, let me see here. If I get stopped, let's see. If I go to the CDES certification, and so it's the CDES Diabetes Educators. ADCES is the name of the website, and this is how you can become certified as a diabetes educator. So if you're interested in working with patients with diabetes, this is the certification program that I'm most familiar with. And most nurses that are CDE certified or CDES certified is usually through this education resource.
Dr. Bowman, can you share that specific screen? We're still seeing your in the resource series. If you can just, or include that in the handouts, that would be helpful.
Yeah, I'll include that in the handouts.
Perfect.
So,
great. All right, thank you. We do have one more question.
Sure.
And this is also from a current registered nurse. How can we encourage patients with low socioeconomic backgrounds to seek help or adhere to the medications, follow a healthy diet? Are there any concrete things you can suggest?
That's a great one. One is find out like your community resources. A lot of times they may not have access to the foods, access to fresh vegetables if you tell them to eat right and exercise. And this plays into the social determinants of health, identifying if they're at risk for accessing food. And then they can qualify for certain programs like the fruit and vegetable program is if they identify to being unable to access it, then they can have fresh fruits and vegetables delivered to them. You'd be surprised, there's a lot of programs out there. Even if they can't afford food, going to the food resources for pickup, if they need to go to like, there's a lot of community where they hand out the foods. They may not be of high quality. They may not be of fruits and vegetables. They may be, they may give out a lot of breads and a lot of carbs, and that might not be very beneficial to patients. So getting them with a dietitian program or one of the national approved programs may give them, and if they're free, that's even better. But then you have the risk of, again, accessing technology. Did they have a smartphone? Did they have access to computers and Wi-Fi and internet? So those are all things that we're talking about. And that's why being innovative in providing access to these services and where to find those programs within your community is so important. And that's why I like to emphasize, you know, once you identify, how do you refer? It's not enough to screen and then to find out there's a need if you can't then associate that person with the next step, which is getting in contact with that program and following up on how they did with that program. And so it's more than just knowing that there's a need and you screen them, is to connect them with the community resource. I'm disappearing into my background.
Great, thank you so much. Really wonderful. I think with that, we've wrapped things up. So again, thank you, Dr. Bowman. It was wonderful. We appreciate your very comprehensive presentation. Thank you to everyone who participated. And I'll say we'll look forward to seeing everyone again at the next Roadrunner resource series. We'll start up again in September. Until then, if you have any suggestions for topics or speakers, let us know by sending an email to alumni@roseman.edu. Thank you so much, everyone. Have a wonderful evening. Thank you again, Dr. Bowman.
Thank you.
Good night.